So today we will study another important topic of female genital tract pathology, and that is extra mammary Pagets disease. So whenever we discuss Pagets disease, a great doctor comes into our mind. His name was Dr. Pagets. And Dr. Pagets discovered in the late 19th century, that is in around about 1874, he discovered Pagets disease of breast, the nipple of breast. Dr. Pagets in 1874 discovered the Pagets disease of nipple of the breast. And when he discovered the Pagets disease of nipple of the breast, it was strongly established. That whenever or most of the times when there is Pagets disease of nipple of the breast, there will be some underlying carcinoma or underlying tumor that will be present in the breast. If there is some Pagets disease of nipple of the breast, it will be a high suspicion that there is an underlying breast malignancy. And what is a Pagets disease basically? In the Pagets disease, there are Pagets cells visible. Pagets cells visible in the epidermis. And these Pagets cells are malignant. These Pagets cells are malignant epithelial cells. When these malignant epithelial cells are present in the epidermis, we call this disease Pagets disease. And first of all, it was discovered by Dr. Pagets in the nipple of the breast. Later on, Pagets disease was also found in the vulva and the bone. So there are Pagets disease of bone, there are Pagets disease of breast, and there are extra mammary Pagets disease of vulva. So in vulva, what happens? Extra mammary Pagets disease of vulva. There is hyperproliferation. There is hyperproliferation of malignant. There is hyperproliferation of malignant epithelial cells in the epidermis. There is hyperproliferation of malignant epithelial cells in the epidermis of skin of vulva. And how will these malignant epithelial cells look? Let's suppose and this is the keratin layer. So below this keratin layer, we are having our epidermis. And this epidermis will have certain cells this epidermis will have certain cells, and these cells will not look like the normal epithelial cells, and these cells will have vacuolated cytoplasms, they will have empty cells, and they will have roughened nuclei, and they will be looking as if they are infiltrating into the epidermis. And these cells will be known as malignant population of the epidermis. And whenever you see these cells under biopsy, so the diagnosis will be extra mammary Pagets disease of vulva. Now there is a very important point that we discussed. Whenever there is Pagets disease of nipple, there is a high suspicion that there is some underlying malignancy. But in extramammary Pagets disease of vulva, there is no underlying malignancy. There is no underlying tumor. Okay? Now, just we will wind up our topic. There are some very important laboratory diagnostic tools, lab diagnostic tools. First one was biopsy, and under biopsy we saw malignant population of cells, Paget cells, infiltrating the epidermis in the Pagets disease. Secondly, the Pagets disease of vulva we have to differentiate this Pagets disease from melanoma. These two conditions are somehow similar conditions, and we have to differentiate both of them. So they can be differentiated on the basis of certain stains. And crane these stains. Whenever there is extra mammary Pagets disease, extramammary Pagets disease will be keratin positive, whereas melanoma will be keratin negative. Extramammary Pagets disease of vulva will be periodic acid Schiff stain positive, whereas melanoma will be periodic acid Schiff stain negative. And extramammary Pagets disease will be S100 negative, whereas melanoma will be S100 positive. So why is extramammary Pagets disease keratin positive and PAS positive? Because as it's an epithelial malignancy, as there is hyperproliferation of malignant epithelial cells, so whenever there is hyperproliferation of epithelial cells, there will be more production of keratin. So these will be keratin positive. Secondly, why is extramammary Pagets disease periodic acid Schiff positive? Because there is hyperproliferation of epithelial cells, and when epithelial cells increase in number, they produce more amount of mucin, and this PAS, periodic acid Schiff stain, will stain this mucin. So extramammary Pagets disease will be periodic acid Schiff stain positive. So here we conclude with our topic extra mammary Pagets disease of vulva. Thank you.